Hello, everyone. Thank you for watching my film. I'm here to talk about Sally, who's a 7-year-old girl. She is exhibiting a lot of signs of possible emotional disturbance, possible behavioral disorder. But at this point, the facts that we have certainly indicate the presence of trauma in her life, perhaps some lack of parental support. Attendance is very low, and disruptive behavior is the main concern that we're seeing here. So, these are not unusual behaviors to see in children that are affected by trauma. And of course, I have the outline of the facts here, but rather than read those, because of course 20 minutes is a short period of time, so let me go right to my tasks. The first task is to explain the process you will use to get Sally diagnosed if teachers raise concerns about her behavior. So I would say, as a background to this, I do believe in a whole school approach. We talked about this quite a bit. It was mentioned several times in our interview. The idea that special educational needs should benefit, and the techniques that we use should benefit the whole school and all children, and not just students with disabilities. This is a primary tenet of special education or special educational needs. And so I think that a lot of attention should be brought. First of all, for example, the positive behavior support model says that there are certain things that we do for all students, and these are what we call Tier 1 interventions. The basic model in positive behavior support is that about 80% of the school is considered, the general population, and most of those kids will not really exhibit serious behavior problems. That's the first tier. And certain interventions, if we want to speak about them in that way, are done always in the classrooms, and things like getting teachers to greet the students, to use positive language towards them, always congratulate them, praise them for their efforts. Things like using cooperative learning and strategies like this that really promote a positive, proactive approach to behavior. So that's the first tier. But at this point, I think we've progressed then to the second tier, which is where about 15% of the students, estimated, would be the students that are showing severe or at least highly significant behavioral problems. And so at that point, in special educational needs, what we do before we administratively, not physically, these tiers are not physical places. It's an administrative way to look at the entire school. But the Tier 2 interventions, the first step is to conduct a functional behavioral assessment. And so I have included that in my email to Ms. Elvira, and that would be document number 1, the functional behavior assessment. Now, in the United States, this is typically done by a psychologist, and the school psychologist would be the person most qualified to do this. But certainly, the functional behavior assessment is really based on observation. So a lot of this will come from the teacher, and I would participate in that myself. And so what we're looking at is recording the data exactly when these things happen, the antecedents that precede them, the situations that seem to lead to these behaviors, the triggering behaviors. This is what we're looking for in the functional behavior assessment. And so what we're doing is we're trying to establish a baseline of what the problem behaviors are at this point. And it's just observational data. It's important to not as if you're not a psychologist, it's important not to make clinical assumptions about anything, because we're not trained to do that. So we just record what we see, and we pay attention to all the details. When do these disruptions occur? Are there certain people that seem to trigger this? Are there any type of antecedent situation that might seem to lead to these behaviors are the things that we're going to note. And so again, if you will look at that document, you'll see that it's fairly comprehensive. This is just a sample of a document. Districts use their own, they construct their own. Again, school psychologists are usually the people that oversee this entire process, but certainly the special educational needs coordinator would be very much in the loop here. So that would be the first process, the first step in that process. The actual word diagnosis, of course, is a medical term, and even at the point of functional behavior assessment, we're still not talking about diagnosis because we're not doctors. We don't necessarily have to diagnose anyone. It's two separate things. In school systems, we classify students as having a disability based on our disability categories, which are very similar in the UK to the 13 categories that we have in the United States. And these are broad categories. So, for example, learning disabilities includes dyslexia, but it's not just dyslexia. Emotional behavioral difficulties, disorders, there's different terminologies in different states. EB, EBD, emotional behavior disorder, emotionally behavioral disturbed. So, but basically what we call the EBD population, that's the broadest category of all. There are so many actual diagnoses that fall under the emotional behavioral disorder category. So we do not attempt to diagnose as we're not medical professionals. That would be the role of a doctor, and we could recommend that the child sees a doctor. Certainly many of these emotional behavioral disorders are treated with medication, as we know. But the most common ones in my experience are PTSD, post-traumatic stress disorder, and this, again, Sally, there's some indication that Sally has experienced trauma, significant trauma in her life, so this might be an important step, and there may be medication that could help her. ADHD is a very common one, as you know, that was mentioned in our interview as well. Depression is one of those, that's one of the serious disorders that often goes unnoticed because it doesn't necessarily result in disruptive behavior. In fact, many times it's withdrawn behavior. But depression is certainly a medical issue. In fact, it's depression and anxiety are the largest medical issues in the United States, actually, sadly, but that is true. That's most of the prescribed medications in the United States are for anxiety or depression. So I don't know what that says about the United States, but in any case, there's a wide range. The Diagnostic and Statistical Manual is, of course, the reference that physicians and mental health professionals use to diagnose these emotional behavior disorders. But in special education or special educational needs education, we don't attempt to diagnose, we merely classify. So we use a variety of assessments, and the beginning one, and the required first assessment in this process is the FBA, the Functional Behavioral Assessment that I just described. So that's the first step. And there, from there, we can, again, in consultation or under the complete direction of the school psychologist, I think that would be an administrative decision, which would be above my head at this point, you know, of course, and so I'm not sure how Cambridge does this, but from the data on the functional behavioral assessment, we craft, or the school psychologist would craft the behavioral intervention plan. And so that would be document number 2 that I have emailed to Ms. Elvira, and you see a template there for the behavioral intervention plan. And what this does is it targets those behaviors that we have documented on the FBA, and it proposes interventions which have a beginning point and an ending point. And this is where the real data collection starts. This is where the serious data collection starts. As you can see on that form, everything is very much everything is strictly recorded. We have a time limit for when it begins, when it ends, and we're looking at it, again, the FBA provided our baseline. So after putting into place these interventions, which I'll talk about in a moment, you know, how we choose those interventions, we want to see the effect of them. And so this is behavioral psychology. So we're interested in what we can see with our eyes. It's not cognitive psychology. We're not asking a child, about their dreams or what they feel. We're not doing that kind of psychology. Behavioral psychology is concerned strictly with what we can see. And so this is the strength of behavioral psychology, is that we use the data and we record the data. And I think that leads really to the second task, which is explain and provide the documentation and process you will use to guide and support teachers, and the method of record keeping for yourself and the teachers. So I want to say, with regard to supporting the teachers, this is on a personal level, based on my experience. First and foremost, I believe very much in, as I said before in our interview, rigor, relationships, and relevance. And relationships apply not only to students and teachers, but teachers and teachers, administrators and teachers. Relationships are the key to a successful school. And so, I like people. I don't meet people that I can't get along with. My whole field is about differences. It's about diversity of opinions and all kinds of people. And so I think I'm good at forming relationships with people and letting teachers know that I'm on their side. It's about empathy, a word that also came up in our interviews. Letting them know I'm on their side. I understand their position. I've been in these positions. I have dealt with these same behaviors many times before, and I have been a general education teacher. I understand the difficulty that they're in. I find that teachers want to do what is best for children, and they sometimes they just don't know how to do what is best for the whole class, because of course that is the crux of the problem in special education, is that the teachers generally don't have a problem understanding the effects of trauma and other really damaging environmental things that happen, as well as disability, which is an internal thing. They don't have problems generally empathizing with that, but they have 29 other students in the class to teach. And this is the problem, because you can't stop the class for one student. And so I could get into the sort of the legal and policy aspects of that, but that's the fundamental question of inclusion. At what point do we have to say this child must be segregated? And the reason children are usually segregated by far is behavior. So, and we don't want that to happen. That's not inclusion. We want the student to stay in the general education classroom. That's why we have the PBS system in place. That's why we think about proactive, preventative measures for behavior before they ever happen. That's what Tier 1 is about. Keeping things positive in the classroom, making sure that students feel that they're cared about, which is as simple as giving students praise, meeting them and greeting them at the door by name, knowing something about them, letting them know that you care about them is the most important proactive step. And that's why we care about that. That's why the PBS system is very effective, and it has great research to back that up. But when we get into Tier 2, this is where teachers start, and this is the place we are in this situation. This is where teachers start saying, I have other children to teach. What are you going to do to support me? Is this student going to stay in this class? If so, how? And this is where the Tier 2 interventions should occur in the regular classroom, but this is much more structured. And so now I will refer you to the link, the pbisworld.com link, and this shows the kind of, specifically the kind of interventions we're talking about. Now, if you click on that link, you'll see that it brings you through a process. First, identify a behavior. So, for example, I would say in this case, disruptive is a good match. And when you click on disruptive, again, the link is pbis.com, and that stands for Positive Behavior Intervention and Supports, which is the acronym that's been adopted mostly in the United States. The original acronym is Positive Behavior Support, which is adopted throughout the UK widely, not only in education but in nursing. One of the sites I came upon talked about PBS. But if you click on this site and you go to identify the behavior, there's many. This is a very well-crafted site. And I'm very impressed by it, and I've been using it for several years now. And so click on disruptive, and you'll see some of the identifying behaviors. And then it asks you yes or no. Is this what we're seeing? So if you would click on yes, then we would go to the next stage, which is showing you the Tier 1 interventions, the ones that are designed for the general classroom for the entire school. And so these are things like positive praise, forming these relationships with students. And there's a whole list of them. And obviously, I'm already running out of time here, so it's good that I didn't try to go through this process by screen sharing or something like that. I think it's better. I mean, look at this link at length. I think it's wonderful. But anyway, those are Tier 1. Now, again, Sally, I think we've progressed probably to the point of Tier 2, and this is the teachers expressing their concern that I don't know if I can keep this child in my room and still do a good job educating the other children, and that is the fundamental problem. So I would say go on to Tier 2, click on Tier 2 interventions, and you'll see some basic guidelines about Tier 2. Now, how long we try these Tier 2 interventions, that's a point of debate. Some people say 4 weeks, some people say 6 weeks, some people have said 6 months. And it's a point of contention, as you can imagine. Because Tier 3, if the Tier 2 interventions don't work, let me just jump ahead. If these don't work, then we go to Tier 3, and Tier 3 generally involves removal from the classroom. I mean, that's what we're talking about here. This is what happens in behavioral in severe behavioral cases, is actual removal from the classroom. And that's something we don't like in special education. We don't like it in general education, but this occurs, and this is the most common reason for segregation now of children with disabilities, and even without disabilities, but with pronounced behavioral difficulties. So at the Tier 2 level, look at those interventions, and you can see this would be something that I would not decide unilaterally, certainly with the assistance and the guidance, really, of the school psychologist. And I don't want to speak beyond my level of expertise. It's as simple as that. But these interventions are chosen carefully, and then it does become my task to make sure that the data is collected and analyzed, and the data must be collected precisely. It's very important. This is a database procedure, and that's exactly what we're talking about here. So that would be my role. That BIP form that I've shared with you, that would be the template. That would be the type of form that I would use. So precise data collection and analysis of that to see if these interventions are working. So the support for the teachers, again, it's on a personal level, but it's also on the data collection level, and explaining these things to teachers, explaining the whole process. That is another thing I think I'm pretty good at. I have learned one of the most important lessons I learned is that jargon is something that scares away people, that scares away parents. It intimidates parents and teachers as well. And so when you start talking about things that are in the realm really of behavioral psychology, it's important to express these in clear language. And I think I'm good at that. Because I think it's very important to do that. So the last part, explain the process and method you will use to get the parents on board with the suggested IEP that the school creates for Sally. So I would say the most important point is to give the parents as much voice as possible. One of the big interventions that goes all the way back to Tier 1 is parent involvement. So bringing the parents in and letting them know that their voice is highly valued in this process. They must be a critical part of the IEP process. The IEP process essentially should be person-centered, with the person being that we're talking about being the person who the IEP is written for, which would be Sally. Now, the parent would be her principal voice, and we want to hear from her. And it's a strengths-based approach. Person-based means we're not just looking at Sally's deficits. We're looking at her strengths, her talents, her abilities. And this also helps to shape our interventions, because you know, if you're good at art and you prefer to do art and doing regular schoolwork makes you upset, then maybe there are ways to bring art into the curriculum for this child. That is the basis of individualized education. That's what an IEP is for. And I will say there's also the concept of buy-in is very important. To get the parents on board, they have to be part of the decision making, and that's something that teachers learn when they teach, is that if they let students participate in a democratic way, you know, with some constraints on that, but if you let students have a voice in making decisions, they will honor those decisions because they were part of it. It's the concept of buy-in. I'm a firm believer in that. And I see I have actually run to 20 minutes now, but I just want to say, as far as getting the parents on board, getting the teachers on board, every case is individualized. We have these guidelines that we can use. We have these documents that we can use. I'm very good at data collection, and I understand behavioral psychology is a data-oriented science, and this is what we're looking for. We're looking for only things we can see with our eyes, things that we can measure, and that's the interventions, the outcomes must be measurable, right? And that's important. That's a key phrase in special education. But I just want to close with the idea that, you know, we're working for Sally. Sally's situation is unique, as all our children, all of our children are unique, but we've got to always keep that in mind. The interventions will be chosen, they will be tried, the data will be collected, and the parents will be brought on board, and everyone will know that I'm there for them. And that's really what it comes down to, is that that's what I'm here for. And I'm always available to be in the classroom with the teachers. I'm available for the data collection and certainly the data analysis. All of that would be my responsibility. And I love forging bonds with people. I do have empathy for parents of kids with disabilities, and I think that's probably the most important thing. So I am out of time, and I apologize for running a bit over. So have a great day today.